Hey everyone, in this video I will talk about why emergency nurses want patients sent up to the wards as fast as possible. Hi everyone, my name is Sep. I am a registered nurse working in the emergency department. In this channel I aim to provide more information about the nursing profession and share my nursing knowledge to help others. If that interests you, please consider subscribing and giving this video a thumbs up. I would greatly appreciate that. So, as some of you know, I have worked on a cardiac and medical ward before going into the emergency department. So I know the feeling many of you have of why a patient needs to be admitted onto the unit so quickly. The feeling, why wasn't this done or that done for the patient before coming upstairs onto the ward, are just some of the feelings. Well, now that I've worked in the ER for a few months, I understand why this is so important. In the emergency department, there are many different sections. Within each section, there are different acuity of patients that are triaged by a nurse when they first come in. Due to the nature of different conditions, a triage patient might actually need more advanced levels of monitoring than what was predicted when they first came in. Therefore, a bed needs to be available in the acute section of the ER, and if there isn't one, the charge RN who controls the flow needs to identify a patient that can go up as soon as possible to make room for the sick patient who has their health deteriorated from the first aid or intake section. That is one example of why the ER needs to send patients up so quickly, to make room for another patient who needs active attention of a nurse. Another reason is that there may be a car accident that occurred and the ambulance service has suddenly dropped off 4 to 5 patients that need health monitoring. Therefore, the ER would need to send as many patients that they have in the emergency department up to make room for the new ones. As a result, the uncertainty and the inability to predict events like this creates emphasis on sending patients up to the wards as soon as possible to make room for another potential patient. Often there are patients also in the waiting room that do not have a nurse, but have acute conditions which need proper assessment. However, due to the congestion of patients in the emergency department, this can cause delays for a patient getting treatment. As a result, again, the charge nurse in the emergency department needs to try to make as much room as possible by sending people up to the wards so that the people in the waiting room can be seen. I hope this video was helpful. I know when I was working up on the wards, I always wondered why the patients are needing to be sent up so fast. But hopefully in this video, you gained some perspective as to why report needs to be given so urgently. Thanks for watching, and we'll catch you in the next video.